Hello everyone, we are going to show you how to perform replicas, neoplastic specimens for grossing, for microscopic examination, for teaching purposes, so simulation-based medical education with medical students or even residents or even assistants, pathologist assistants. We are going to use Alginate, and we are going to use these molds we have created. So Alginate is for dental purposes. You can find the vinyl one, so it is yellow, it is powder, but if you mix with coffee or with paprika powder, you get different colors, and that's what we want. We want to achieve different colors, to mix them to achieve a tumor, for example, inside a thyroid. So this is the molds we have created. This is a 3D printed technology. We have different specimens. We have a skin resection one, we have a lipoma, a lymph node, a thyroid, appendix. We have also a gastrointestinal polyp. And the one we want to produce this replica are the thyroid, the polyp, and the skin resection for teaching purposes, and we have implemented this at our institution. And we have tested with different medical students as well. And the results are pretty good. So first we have to prepare the mix of the alginate with the powders to get different colors. So you need 2 people to perform this at least. That's why alginate consolidates in just a few seconds. So if you want different colors, for example, epidermis and dermis and subcutis, or you want a tumor inside the thyroid, you need to mix them, the different colors, at the same time. So it doesn't work if you want a tumor to produce first the tumor and then embed the tumor inside the thyroid. It doesn't work. So you have to do at the same time. So you have to do as fast as you can, because alginate consolidates itself, and just a few seconds later you insert in the mold. So for the coffee, it's better to use to sift the coffee with a strainer to be very tiny fragments to achieve a good mix. So yeah. So we are going to put the proportions of the alginate and water, because we have to mix with water to achieve the specimen itself. So we have to prepare some syringes, and the proportions are always more or less the same. So I mean, it's 8 grains of alginate with 18 or 20 milliliters of water. So she's going to use 2 syringes and 2.5 cups. So first of all, you have to familiarize with the amount of alginate and the proportions, but once you have your own cup, your own spoon, you can easily do that. So she's going to do the majority of the sample, and I'm going to create the skin resection, the deeper part, and the tumor. So I'm going to use alginate with paprika powder, and she's going to use alginate with coffee powder. So let's start. We have prepared the syringe for the mixture, and yes, so you can use 1 for me.
1 cup.
Okay, 1 cup for me.
And 2.5 for me.
¿Estamos grabando? We are recording. Okay, so put the amount of coffee depends on the degree of darkness you want for the specimen. So, but maybe 1.5 spoon, tiny spoon for coffee spoon for the specimen is fine. So first we have to mix the alginate with the powder, with the different powder, the paprika or the coffee one. Be sure that you have mixed it properly. Okay, so once you have mixed, you have to add the water. So 1, 2, and 3. Okay. And then we have to mix. Okay. As fast as you can. I got it because I have less amount than the hair.
Okay. I go.
Okay, you can start. I'm putting some amount in the syringe because the tumor has to be inside the thyroid. So I use a syringe. Okay. She's finishing with the polyp. So we have decided to create the gastrointestinal polyp, the thyroid, and the skin resection specimen. Okay, so now we have to close it and press a little for some seconds. Maybe we can wait around 1 minute. Put different gloves in order to be as clean as you can, and you can create around 20 replicas in maybe 2 hours if you do it fast. And that's all. So only alginate, the powder, the coffee and paprika powder to give a color, and then some water to mix, and that's all. Taking advantage of this, of all this, we use different molds. So once we have created one, we start performing the second one, and so we have like 3 molds. Can you take that one?
Yeah, cool.
So in order not to lose time. So the mold gets a little bit ink because of the color of the coffee and the paprika, but it doesn't matter. So we have prepared a lot, and it works pretty good. So you can download the file to print your own mold in the QR code.
Maybe it's ready.
Yeah, it's ready. So this is. You will see that this is fantastic. The result is almost perfect. So we have opened it, and we can wait a little bit more, okay? But I think it's okay. So this is the skin resection specimen, the gastrointestinal polyp. So you don't need silicone. You can standardize the teaching of gross dissection with all the medical students with the same specimens. So this is formaldehyde free, so no formol is here. As you can see, we have the skin with the surface is with a different color than the deeper part. We can ink the specimen, so the professional ink works pretty good. So by removing this, you will see that the specimen is perfect. So you can keep it in the fridge. You can use, we are using now some vacuum bags, because in the fridge you can keep them like several months without problems. So this is the thyroid. This is the skin resection, and this is the gastrointestinal polyp, and you can easily ink it, and if you want we can section it. We use the app SimInPath to assess this competence, the ability to perform grossing with medical students. So, well, once it's inked, you can easily section it. The texture is very good. If you don't mix well, it also mimics thyroiditis, for example. So here the specimen is homogeneous, but then you will see that the tumor appears. Depending the amount of alginate you put inside, the tumor is larger or not, and even you can play with the margin. So surgical margin can be touched or not. So as you can see, it is pretty easy to perform your own specimens, your own replicas, and you can ink them as well, and for a standardized teaching of gross dissection. So thank you, Fuen.
Thank you very much.
Thank you very much.